Welcome to the Amazing Cities and Towns podcast. I'm Jim Hunt, your host, and today's episode will focus on a very important issue affecting local governments throughout the country. Our guests are Mr. Angelo Consoli, president of the Fraternal Order of Police in Prince George's County, Maryland, Lodge 89, and Colleen Hilton, a licensed therapist and founder and CEO of Alli Connect, a Seattle-based technology company that assists in finding the right therapist for mental health care. Let's go first to Angelo.
To get the help when you need it has to be the paramount. You can't wait, and especially because a lot of officers, what we're used to doing is putting it down, ignoring it, and letting it go. And if you get to a couple of days later and you've done that, you move on, you move to the next one, and eventually those things build up until, like any shaken soda can, you're going to explode.
And Colleen, I know across the country, and you operate throughout the country, many states are looking at this. So what's that look like across the country on these various states that have put this in as a mandate?
Yeah, I mean, that's a really important topic. I think, Angelo, to what you were just saying, more and more legislative bodies and governing bodies are recognizing that officers often struggle and suffer from death by 1,000 cuts, that it's not necessarily a single incident that leads to potentially PTSD and suicidal thoughts, but that the accumulation of stress and incidents, at some point, we all break. So we've seen a lot more legislation coming into bear in many states, both recognizing the long-term impacts and that death by 1,000 cuts, PTSD, being attributed to service as a whole, as opposed to a single incident. But we're also starting to see mandates around proactive mental health check-ins, everything from annually to even quarterly, where agencies are now being encouraged, if not required, to really touch base with those officers, on a regular cadence to make sure that there isn't anything kind of boiling underneath the surface that's going undetected. I think that's a really important component in this cultural shift in reducing the stigma, is that if we can normalize the mental health check-ins in the same way that physical wellness check-ins have been normalized, and normalize proactive tools like Alli Connect in the same way we use ballistic vests to protect against a physical injury, we're going to be protecting the entire person, and they're going to be better off as a whole in turn.
And one of the, and I know, spending a lot of time on the policy side of local government, and sometimes when things are mandated, they end up kind of the check the box, so that it's not true services, but it is checking the box. And I think a lot of the Colleen, maybe just talk about the difference between checking the box and actually having a true, just like Angelo said, is needed, is immediate access to care and the right care.
Yeah. Well, I think agencies really need to start looking at what is their culture right now and what are the solutions they're going to help create supports for their individual officers based on that individual culture. So I don't think there's a one size fits all solution. In terms of checking the box, I think we've done that historically as a society, not just in the first responder industry, but in government and city municipalities, by leaning into EAPs, which are employee assistance programs, which oftentimes provide 3 to 6 sessions for a client who might reach out to their human resources contact and say that they're needing help. And it's very difficult for an officer to call human resources, pick up the phone and say, hey, by the way, I think I'm struggling with alcohol abuse. I need help. It's tantamount to career suicide. They're just not going to do it. And we see that in the statistics that first responders have less than 2% utilization with employee assistance programs. So I'm really encouraging agencies to put together their own programs, partner with companies like Alli Connect and others that are in the industry that can build something that's more customized, and provide access to care to what we call culturally competent therapists, or therapists who actually know and have experience in working with these specialized professionals.